My name's Tracy Bemis Smiley. I use pronouns she and hers. I am the Sexual Assault Program Coordinator for A Better Way Services and also the lead call handler for the National Suicide Hotline. A Better Way Services answers the suicide hotline for 37 counties here in Indiana. We are also getting ready to start the chat program with the suicide hotline, so we'll be receiving chats with individuals across the nation who are also having thoughts of suicide but prefer to chat about it instead of calling in and talking with somebody over the phone. So according to the Center for Disease Control and Prevention, suicide is the 10th leading cause of death in the United States. According to the American Foundation for Suicide Prevention, in 2018, there were over 48,000 deaths in the United States related to suicide, and 1.4 million people that attempted suicide. 48,000 deaths, that equals approximately 132 suicides per day. So it's about 5.5 suicides per hour. That is a lot of individuals that are reaching out for help and help is not reaching back for them. About 1 in 20 people consider suicide. Personally, I feel like that statistic is low because some people are so private that even if they knew it was confidential information, they might be embarrassed or feel like there's a stigma if they actually said, yes, I've had thoughts of suicide, even knowing that their information was not going to be disclosed to anyone. So I really believe that 1 in 20 is a very low rate for individuals that might be having thoughts of suicide. What are some of the risk factors related to suicide? Well, there's many of them. Sometimes it's their health, maybe related to mental health, traumatic brain injuries, having serious or very painful health issues that are terminal, where you know you're just in pain constantly and there's no end to that pain. And suicide might be that option. Sometimes it's environmental. So there's a lot of stress factors. Many prolonged stress factors, such as being bullied in school or abuse in the home. Stressful life events, going through a death in the family, a divorce, financial problems, maybe even experiencing a loved one or a family member or friend that has died by suicide. And just having lethal means in the home can be a huge risk factor. Sometimes it's historical, that you have lost somebody to suicide. Many people believe that suicide is contagious, that there's a gene in us, that if suicide's been in the family, you are at greater risk for attempting suicide. Maybe you've attempted many times in the past, or you've experienced childhood abuse and trauma. We know trauma affects us starting at an early age, and if you experience that at an early age, it interferes with the development of the brain. And prolonged abuse and trauma through childhood can lead to many negative health and mental health factors as an adult. So when we look at suicide, there's many terms that we use. There's suicidal ideation. That's having thoughts of suicide. And there's different forms or different levels of suicide ideation. We might have just the thought of wanting to die or wanting to sleep and never waking up. We might have thoughts of suicide, but with a method. You know, I've had these pain pills that I might take. Or we have thoughts of suicide with an intent, but without a specific plan. I really want to die, and this is how I would do it. And then there's active thoughts with a very specific plan and intent. So you've planned out your method, you've planned out a time frame, and your intent is to die. Those are all just ideations, those are not things that we've actually put into action. We have suicidal behaviors. Those are things where we've actually acted on those thoughts of suicide. where we are preparing, we're maybe writing notes to loved ones, or we are preparing our will, we are gathering possessions or gathering the method to suicide. There might be some actions of actually attempting suicide, but then we aborted. We decide we don't want to die, so we stop. Or we're acting on those behaviors and it's interrupted. Somebody is able to stop us before the suicide happens. And the final term that we use is suicide. That is actually taking your life by your own means. We don't say a person commits suicide. We say a person died by suicide. Death by suicide, for many people, is the only way to stop the pain. When we know somebody is having suicidal thoughts, the best thing to do, don't judge that person. We don't know the pain that they've gone through. Emotional pain that a person is experiencing, caused by whatever traumatic event they've gone through, is the worst pain that a person can feel. One of the best things also is to not talk about future. Let's not discourage them from talking about why they want to suicide. Give them that opportunity to express what they're going through at that point in time. These are the best ways to help a person who's having thoughts of suicide. So, with so many risk factors that are out there, when we think about the LGBTQ community, there are so many more risk factors. According to the CDC, the LGBTQ community have 4 times higher rates of suicide than the cisgender population. According to a Trevor Project 2020 survey, this is their second annual survey that they've completed, 40% of individuals that identify within the LGBTQ population have seriously considered suicide. 40%, that is 16,000 people of the 40,000 that took this survey. 48%, almost half, engaged in self-harm behaviors. 55% had major depressive disorder, and 68% had anxiety disorders. All of this triggered because they identified as LGBTQ. Why are these huge numbers? Why is this something that we need to think about? Because we need to think about what's different in that population. They have higher rates of discrimination, higher rates of prejudice and abuse, being belittled, being discriminated against regarding the gender that they identify as, being left out, not able to use a public bathroom that they feel most comfortable in. Something so simple as that. Imagine if you're prevented from using a public bathroom that you feel comfortable in, where you would feel safe. So many people in the LGBTQ population don't feel safe in the community and have higher rates of suicide. So what are some protective factors? Their obvious resiliency, having support systems, having peer support systems, having family that support them. Those are the best protective factors. Having individuals that a person can turn to. That's all anybody wants, is to feel accepted and to feel loved. So what are the best ways to work with the Pride community who are having stressful times, who might be having thoughts of suicide and need somebody to talk with? First of all, you need to check yourself. Check what your biases are. If you say, I'm comfortable with this, but, etc., well, that but is huge. Check what that is. You need to put your own biases aside. Capture your own thoughts and challenges with the Pride community. Put all that aside and be open to the discussion and that individual. Also, mirror their language. Don't assume because one person feels comfortable with the word queer that all people will feel comfortable with the word queer. Mirror their language. But ask first. Maybe they're comfortable with saying it, but not comfortable hearing it from other people. Validate who they are. Validate their expressions as a person and their identity and their sexual orientation. They are an individual and they need to be validated for who they are. Normalize what they're going through. Normalize their questioning. Normalize their exploration of their gender identity. Be aware of your own impulses and reactions. So, not being over dramatic when you hear something that they've gone through or that they experienced. And also, explore the benefits of the risks for that individual. What are that person's risks? Not everybody can move forward at a safe time. Not everybody can talk to individuals that they feel like won't support them. So you need to normalize that for them and ask them, what are the risks? How serious are they? What are pros and what are cons? And take it at their level. Take it at their speed. The last thing is, don't ask questions just because you want to be curious, just because you want to be nosy and find out more about it. That's not the time to do it. The time is to focus on them and only ask questions that are going to be beneficial in helping that individual. Never be judgmental. Never tell them you will keep secrets. Be there to support, be there to listen. And also, we're not there to try to solve a problem, especially when someone's having thoughts of suicide. We're not going to solve that problem. What we want to do is keep that person safe. We want to keep them safe for now so they can move forward and get the treatment that they need. The best thing to do if you think someone's having thoughts of suicide, ask. Ask openly and ask directly. Are you thinking about suicide? This is the best thing because it gives them no other options to say, well, I didn't understand what you were meaning. It's either yes or it's no. If it's no, you will not put that thought of suicide into their head. We can't be influenced that easily. If it's yes, listen without judgment. Thank you for coming to A Better Way. Thank you for all your work that you do in the community and for allowing us to participate in Pride this year.